Hi, we're going to see supraclavicular flap skin marking. First of all, the bony landmarks are marked, that is the clavicle and the scapula. Following marking the bony landmarks, the sternocleidomastoid is marked. And then the external jugular vein. For better visibility, the external jugular vein is filled and then it's marked. And this triangle forms the landmark for supraclavicular artery, that is the posterior border of sternocleidomastoid, clavicle and the external jugular vein. Where comes the multiple perforators, that is the supraclavicular artery. The perforators from the transversocervical artery will be seen just 2.5 to 4 cm above the clavicle and average of 2 cm posterior to the sternocleidomastoid muscle and 6.5 to 10 cm from the sternoclavicular joint. The multiple perforators arises from the transversocervical artery and forms the supraclavicular artery and which supplies the flap. The distal extent of flap can be extended up to the insertion of deltoid. The posterior margin of the flap lies 2 cm just in front of the spine of scapula and a parallel line is drawn to the posterior margin which acts as the anterior margin of the flap. The width of the flap can be taken up to 12 cm and length up to insertion of deltoid. The triangular landmark acts as the base of the flap. The vessel need not to be scrutinized other than for microsurgical flap harvest. And now you can see the flap arc of rotation once the flap is raised, and it can be used for lower face defect and also neck defect because of its texture and color match and the pliability and hairless nature of the flap. And it also a very thin flap which demands its use for flap reconstruction. Thanks for watching.